Welcome attendees to our 360 approach to food delivery, scientific research, and CFP collaboration. Today's session is the third in our webinar series, and we will focus on the academic sector. We are excited to welcome back Dr. Don Schaffner for his second appearance with us. Hey, Don. We also have the privilege of having the renowned Dr. Ben Chapman with us today. Hey, Ben. We are mixing things up a bit in this session, and there will be no PowerPoint slides. We pulled together some discussion topics, which Dr. Don and Dr. Ben will be covering. We highly encourage you, the attendees, to send in your questions and comments, which we will pepper in throughout the session to keep the conversation interactive for both the speakers and the audience. Please feel free to type your questions and comments in the chat tool, and we will address them at the appropriate time. We're looking forward to a fun, interactive experience today. To kick it off, Tara has a few questions for our audience. So over to you, Tara.
Thanks, Tracy. Happy Wednesday, everyone. First of all, let's find out, who are you? So if you would please take this poll. Are you regulatory, industry, academia, professional association, team member, or top secret? Okay, 3 more seconds. All right, the poll is officially closed. We have 73% regulatory, 11% industry, 10% academia, 3% professional association, and 3% top secret. Excellent. Welcome, everyone. Okay, now, where do you call home? Northeast USA, Southeast USA, Midwest, West, US territories, or international? On your mark, get set, go. Okay, 3 seconds. 2, 1. The polls are now closed. Survey said we have the most people in the Southeast, 30%. Welcome, Southeast. Followed at 29%, the Midwest. Welcome, Midwest. Then West part of the United States at 23%, Northeast at 16%, and US territories and international 3%. Fabulous. Again, welcome, everyone. Our last poll question. Where are you in your career? We want to know about you. Are you in the beginning, middle, end, out to pasture, or top secret? Vote, vote, vote. 5 seconds left. 4, 3, 2, 1. Polls are closed. Okay, we have 50% in the middle of your career. Fabulous. 23% towards the end, 21% in the beginning, out to pasture 1%, of course, top secret at 5%. Thank you all very much for participating. And that's the goal of this session here today, is to make sure that everyone participates and that everyone is a part of this great experience. So we're going to first and foremost thank you, Dr. Ben and Dr. Don, for your time today. We sincerely appreciate this. And as the Active Professional Series, we want to look at positive results of the current climate. So as a result of the pandemic, what additional activities are you currently participating in to assist your students, as well as industry and regulatory professionals during these uncertain times? Who would like to start, Ben or Don?
Well, assuming that Ben's power stays on, I think he's best suited to actually answer this question. If he does drop off, I'll fill in, but I think, Ben, we can talk about your super secret project that's finally been revealed to the world accidentally on the internet, apparently.
Yeah. Yeah, so I guess there's a couple of things. You know, there's been I'll be like super obvious and try with my statements. Everyone's experienced some major shifting and challenges, and the academic world is no different from that. So what I would like, what we were planning on doing this year in my group was a whole bunch of like bringing people into kitchens and figuring out how they handle food and evaluating what it means when someone uses a hand sanitizer in a food service setting and doesn't wash their hands but uses sanitizer after making 30 sandwiches or burritos. Like things like that was, if I go back to where I was in mid-February, we were planning on doing those types of things. And what became really, really clear, and it's all like kind of messy in my head on dates, but there was some time before March 1st, and the reason I know that is because Dawn and I actually saw each other at a meeting on March 1st, and things started to be a little weird, right? Like we were at the American Frozen Food Institute. They had their we're part of their scientific advisory panel, and there was like a sign up in a reception saying, if you don't want people to be close to you, take this little dot and put it on your name tag. And we had this conversation thinking like, when we're at meetings like a month from now, 2 months from now, what do you think is this going to be the norm? And it's like silly to think back to it like now, because 2 weeks later, you know, almost everyone was in shelter in place. But in that like February 15th to March 1st, we started getting a lot of questions from people that we work with all the time in the food industry about this new emerging pathogen. And everyone kind of started with, well, we know that this isn't a food safety issue, but in my organization, there's nowhere else to go, right? Like, so someone who's doing, you know, works at a quick serve company and they do food safety, quality assurance, they're like, you know, microbiology, so deal with this new pathogen. And so how things really shifted for my group was somewhere in between February 15th and March 10th, we just moved everything to better understand SARS-CoV-2 and try to read as much as we could, investigate, look, do what do we know about SARS-CoV-1? How does this impact food? And so my students, my staff, my whole group shifted, and we started making resources. And so Dawn alluded to this. What came out of that was over a 2-month period, we created about 150 different things that we put out on social media. We distributed to the food industry, and then USDA, the National Institute of Food and Agriculture, put out a call for funding for people in the food industry to rapidly respond to this pathogen. And so we responded to their response, and were awarded a grant to investigate SARS-CoV-2 in food settings, and the project is called Food CoVNet. And so we weren't able to talk about this up until last week when it all became public. But over the next 2 years, how things will really change is probably, I don't know, 80% of my time is going to be focused on this issue, and in a different way. Like, we're learning things that we hadn't been exposed to before that has food safety implications. And I'll give you just a salient example of that. So many of us have been asked questions. We've seen reports of HVAC systems and recirculating air being of importance for this virus. Well, what this might push us to do is to understand better about how HVAC systems and recirculated air is important for other foodborne pathogens. Maybe it is, maybe not. It's not something that our world has really focused on. So I guess like that's my long-winded answer to your question of how things have changed. It's changed drastically. There's still always this food safety aspect in the back of what we do, but us, and not just us, but many out there have fit this niche of there's not a lot of other places to go to answer questions about this. So can you answer the questions? And I'm game for that, and my group's game for that.
Excellent. Thank you, Ben, very much. Don, do you want to elaborate on it from your part of the world?
Yeah. So thanks for that awesome overview, Ben. And I have to say, I have a huge debt of gratitude to Ben and his team for reaching out to a number of us to say, hey, look, we're doing this thing, we're leading this thing at North Carolina State, but we know that we need your help, right? And engaging me and a number of our mutual friends and colleagues to say, hey, look, we're going to be putting out a lot of information and it needs to go out really quickly and we need to get it vetted. And so we want you to be part of our team of people to review these documents, to give us feedback, to be part of it, and then it all just sort of swept along until the opportunity to kind of formalize it with the USDA funding came along, and that was fantastic. A couple of sort of perspectives on my activities in all of this. I have, I think I'm doing it to a less of an extent just today or this week or lately, but one of the things that I did early on was got involved in stuff going on social media with respect to this. So I've got, thanks to the podcast that Ben and I do, I've got a number of Twitter followers who are what I would refer to as normal people. That is people that just, they're not safety professionals, but they're people that are interested in science and they're interested in germs and risk and things like that. And so I got tagged into some Twitter conversations and people were asking for my opinion. And so I used Twitter to basically try to communicate to people. And some of the a lot of the discussion around SARS-CoV-2 and COVID-19 has been around food, even though we know that it doesn't seem to be spread by food, it doesn't seem to be spread by food contact surfaces, but people also know, hey, you can get sick from germs in food. And so what if somebody coughs on my takeout, right? What if somebody sneezes on my groceries in the grocery store? What do I have to do about that? And one of the things that went viral fairly early on was a YouTube video from a family, a GP, medical doctor, basically explaining in great detail how you had to use aseptic technique when you brought groceries into your home. And I looked at that, and I mean, I'm a microbiologist. I understand aseptic technique. I understand what he's trying to do, but it just looked crazy making to me. And I thought about it and I put out my hot takes on Twitter, and lo and behold, some people were really interested in that. And then people, we do research in cross-contamination, in hand washing, in microbial survival. And so I got really interested in like, well, okay, so what do we know about what do we know about SARS-CoV-2 and hand washing? What do we know about SARS-CoV-2 and soaps and hand sanitizers and things like that? And started looking for opportunities, again, many of these on Twitter, to engage with people and say, hey, look, you're saying this one thing, but I've actually looked at the science and the science says this other thing. Or somebody reaches out and says, hey, should I be worried about this? And I'm like, well, I don't know. Let me think about it. Let me go read the literature and let me figure out what I think. And then let me tell you what I think. And let's do it in a public way where we can get all this information out. And then I also have to give a giant shout out to a number of my colleagues from the predictive modeling world where we do research, and they were working on a policy document. They're almost all of my co-authors on this were French, and they basically started collecting literature looking at coronavirus survival as a function of temperature, right? Like not only possibly if it was in food and you wanted to inactivate it by cooking, but also what happens when you have it at room temperature, what happens if you have coronaviruses in the refrigerator or in the freezer, and basically building a computer model for that. And so that's kind of what I was doing before in terms of mathematical modeling for microbial behavior in foods. But lo and behold, the math doesn't care, right? The microorganisms don't care. You can take those same skills and those same techniques and you can apply them to what we know about coronaviruses. And again, just a huge shout out and thanks to my French colleagues for involving me in that publication. And we actually worked very quickly collecting data and analyzing data. We got a publication recently published in Applied Environmental Microbiology, which actually, again, further sort of, again, the more that you do and the more that you're seen to be doing something that's relevant to people, the more opportunities come along. And in fact, I just had a phone call today with somebody who'd seen that article and wants my take on again, stuff related to food safety or virus survival, not food safety, but virus survival in restaurants. And so it's been a bit of a whirlwind. As I explained to people, I was kind of doing two jobs for a while. I was doing my regular food safety job and my new SARS-CoV-2 COVID-19 job. And I think to a certain extent, I found a balance there. But again, now that and it sort of was nice over the summer. I always get lulled into a false sense of calm over the summer because things kind of quiet down. But here we are mid-September, and things are roaring up again. And we've got this new grant to deal with and new opportunities. And now we've got research going on in the lab. That's the other thing we started doing is we are not a virology lab, but we have done work in the past with bacteriophage MS2. This is a virus that infects E. coli, and we were using this virus as a surrogate for norovirus. And just like there's a surrogate for norovirus, we think that in a bacteriophage called 5/6, which infects Pseudomonas, we think that this is maybe a good surrogate for SARS-CoV-2. And so we're ramping up our lab's capability to do research with this microorganism in hopes that it'll inform our knowledge base, again, looking at things like virus survival, cross-contamination, and things like that. And so it's been, as somebody who thinks about microorganisms and somebody who thinks about risk and about models, this has just been kind of a different way to stretch my brain a little bit, and it's been fun and it's been exciting, and yeah, I'm in it for the long haul. I mean, it's the other thing too. I would say this is such an important issue that we're facing as a humanity, right? And it would be, I've got tools that I can bring to the fore to help. And so I'm here to help, right? That's one of our things in cooperative extension. People like Ben and I that work in cooperative extension, we like what we do because we like helping people and we like, providing them with science-based information. And this is just another opportunity for us to do that. So it's been a wild ride, but so far so good.
Thank you very much. So I'm going to toss it over to Tracy. We have some questions from the audience. Okay, Tracy, here you go.
Yeah, so we have one question. I believe this is for Ben. So will food CoVNet information be available to a wider public and when, or could you elaborate on how that information will go out?
Yeah, so great question. Yeah, it absolutely will be. One of the things that our start date was September 1st on the project. And one of the very first things that we've been working on is a website that will house all the stuff that we're putting together. One thing that I think Don and I, this is not just, I shouldn't just say Don and I, our group and others like us in our network of land grant extension folks who work in food safety, we did a lot of sharing and we continue to, but over the last 5 or 6 months about what is this industry doing, what's working, what's not. And so one of our big deliverables on this early on is really a clearinghouse of best practices and things that work and might not work, or questions that we all should be asking. And so yes, this will all be publicly available. One thing that we didn't mention with this project is we're working with a huge group of stakeholders. That APTO is one of those stakeholders. Steve is committed his time and sits with our group monthly to talk about what are APTO members needing around this area. And so there'll be a lot of dissemination of this through the trade associations and other associations like APTO and NACCHO as we go forward. But yeah, it'll all be publicly available and out there for sharing.
Excellent. Thank you very much. Now, we obviously love what you've shared with us so far today. Can we get a little personal with reflecting over this time, how have you personally been dealing with COVID-19 and a rapidly changing world? Because can you give us some insight?
Sure. I mean, we'll just alternate. It's like when Don and I do our podcast, we just kind of go back and forth. So, okay. So here are some personal things. So I've got 2 kids. They're 12 and 10. And Don, I talk incessantly about them. And so they're both in virtual school and are here at home, like literally here and there throughout the day. And that's been it's a struggle. It's a challenge. Like being at home. I love to work at home before. I love to work at home because no one was here. And in my office, there were people, and my kids were at school, and like my wife is here, but we really get along and it can get to like different parts of the house. Now it's like there's a lot of people here, and so that's been that's been I think a challenge, and it's also non like food things, but the struggle of virtual like online learning for my kids. We're a few weeks into it now, and I don't think we've had a day where someone hasn't cried. Like me, them, they're like it's emotional. It's tough. It is. There's a level of frustration because it's not what we all kind of signed up for. And so I think that's been that's been difficult. So I'm from Canada originally, and every summer, that we go back and visit our family, and the border continues to be closed, and it's not, they don't really want people who live in the U.S. coming to Canada for, I think, obvious reasons. But then the border is it's not even an option right now. So that certainly has been a change. And then I guess the third big thing for me, and Don and I have talked about this on our podcast. I know food safety and I know hockey. Like those are kind of the only two things that I know about. And I haven't played hockey since March something, 4th. And that's been really difficult. And it's also been difficult being someone who's in this food safety infectious disease world with like knowing about this and then being like leaned on a little bit as a resource, at least informally, by my own team, by folks that run the league, and everyone's kind of like, what do you think? Should we go back? How do we manage this? And that, like, I don't know, that's been a very difficult situation to be in, because my answers might not always be like the answers that they want to hear, which is like everything should be fine and kids aren't going to get it and all that kind of stuff, which is not how I feel. I actually think that the act of playing hockey is probably pretty low risk, but getting dressed, sitting in a dressing room, sitting on a bench, having these kids who are in contact with each other, for my kids and then me as an adult, those are the risky parts. And so like living through that's been, I don't know, that's been hard. Like it just I've had to encounter this in lots of different ways. And those are like small challenges. No one in my family has been sick. I've been very fortunate throughout this pandemic from other personal things, but yeah, that's been my situation. How about you, Don?
Yeah, well, I'd say the same thing. Like I work from home a lot already, and it's just my kids are grown. As long as my wife has explained, as long as I'm in a room where I can shut the door and she doesn't have to listen to me talk, because she hears half of all of my conversations. Because she, I have headphones on, so she can't hear you guys. As long as she can shut the door, it's fine. And so we've got a big enough house we can do that. The other big change for me, so obviously when the barbershops here in New Jersey were closed, I stopped getting a haircut. The barbershops are open. I still haven't got a haircut, as you can see. I'm not really sure how long that's going to go on, but at least for the foreseeable future. Right now, there's not a I know in Ben's house, the same thing was going on, but then there was a decision made that he needed to get a haircut. I'm not sure it was what do you call it? The minority, majority, anyway, the people that made the decisions decided that he needed to get a haircut, and so he got a haircut. But for now, I haven't, and so that's been interesting. Like I said, it's just kind of an experiment. We'll see where it goes. Like I said, my kids are grown, but we've got a couple of dogs, and the dogs. I guess the only downside for the dogs is they don't get to go to the kennel anymore, because we're not going away on trips. And certainly I don't miss the travel. I miss being other places. I certainly don't miss the travel, but I'm not ready to go anywhere. And the dogs are really enjoying it. So the other thing too, because of my busy travel schedule and a general tendency towards procrastination, I was overdue. This is probably a little bit of oversharing, but this is something that we do on the podcast. I was overdue for a colonoscopy, and so because I'm not traveling, it actually made it relatively easy to get my colonoscopy scheduled, and so that's something I'm really looking forward to. Before I do that, I've got to jam a giant Q-tip in my nose to make sure I don't have COVID, and so I'm looking forward to that too, a whole lot. But the other thing that's going on that is going to be very interesting to do during a pandemic is we are in the process of selling our house and moving somewhere else. We don't have a new house picked out yet. I guess the good news is we've been told here in New Jersey it's a seller's market, but the bad news is that eventually we have to buy a house too. But it's interesting to watch how all of that is working now in the midst of the pandemic. Obviously, a lot of people wearing masks, a lot of signing of forms and holding harmless and things like that. And so it's been really interesting times to do all of those things. So yeah, but I would say, in terms of my overall work productivity, it's not having to travel actually gives me a little bit more time. I work from home a lot anyway, but now I'm not commuting into work at all. That's cut into my time for listening to podcasts, but it really has improved my work productivity overall. So it's pretty good. And again, like Ben, I've been blessed that none of my immediate family, we did have one of my wife's cousins did get COVID-19. He's younger than us though, and he apparently has made a full recovery. But my parents are physically distancing and staying healthy, and my wife's parents are as well, and our extended family also, again, doing their best to stay away from people. And we've all been blessed. My son did lose his job because of the pandemic, but he's a computer programmer, so he was pretty easily able to find another job, and actually started back a couple of days ago. So it's been good overall, but I mean the pandemic's been horrible, especially for those that have been so adversely affected. But again, from a personal perspective, I've just been very lucky that it's really it hasn't impacted me too much, and so I think I'm very thankful for that.
Well, thank you both for giving us a little glimpse into your personal life, because we all see you from a professional standpoint, and it really is refreshing. Thank you so much for sharing that with all of us. So I have a question. Ben, are there any COVID-19 lessons learned that you could tell us, I would never do that again? Like, I would never, ever, lesson learned, don't do that again.
So, okay, I'm going to give you one that I wish I had done differently. That might not go into the I would never do that again. Oh my gosh, what a mistake. But it gets a little, I guess it gets a little technical, but one of the challenges for all of us technically in this pandemic from a food safety standpoint is really trying to tell people, why is this not a food safety issue? Right? So there's epidemiological reasons, right? So, okay, we don't have any clusters associated with food, with food. There's been clusters associated with food settings. There haven't been any common, a bunch of people got sick harvesting produce on a farm because they all work really close together. But we haven't seen illnesses associated with that lettuce or those tomatoes or anything like that. And I because of what Dawn and I have been doing, and amongst others, again, I don't want to you get the two of us, but there's a whole bunch of us that are doing this type of thing nationally and internationally, trying to communicate these issues, because we're kind of out there. We get a lot of emails, a lot of people tweet at us, and that the question of explaining the biology of, why does CDC tell us not to touch our face if I can't get it from my hands? Like, can I not take it off food and touch my face? Or why is it that it can only be, and it's not only, again, this is the questions, but why is it that you're telling me that food's not an issue, but the virus goes into my mouth and my food goes into my mouth, and how are those things differently? And I think really early on, we tackled this question, and it's kind of like, well, there's biological reasons for it, right? Like, and it's not a zero risk situation. It's just really, 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 really unlikely. So maybe over the course of a billion servings of food, there's a 1 in a billion chance. But you know, over the course of close contact with someone who's symptomatic, it's a 1 in 2 chance, or whatever it is. You know, like those, that being able to talk through those risks. The thing that I wish I had done better was thinking about how to communicate that in a really succinct way. And there were, you know, lots of, and again, I think we've all experienced a level of burnout with this world, right? Like, that things have changed. Our normal outlets to break up what we do in our work and what we do at home don't exist anymore. And especially in the first 4 or 5 months of this, I would often get like a question on Twitter where it was like, I think you're wrong. I think people are getting sick from food. And I would just be like, I don't have a really quick answer to tell you why I don't think that's the case. And I don't want to explain it to you right now. So I would just like, I'm not going to deal with that. And then maybe like 3 weeks later, I'd be like, okay, I can answer that question. And now I've got a much more robust way to think about it. And I've thought about communicating a lot, but I really struggled with that, right? Like it's, you know, it's really answering the how do you know? And often what Dawn and I are really used to is, well, I don't know for sure, but here's what the evidence is pointing towards, and being able to communicate that in a really like low trust, high emerging information, very emotional situation. I wish I had thought better of it in March, but it really took me until July to figure out how to succinctly answer that question in a way that I feel comfortable, where it wasn't kind of like, don't look behind the curtain, which early on I was like, well, just don't look behind. It's not. Don't look behind the curtain. And it was a little more of that, but you know, I wish I had thought more about that. But there was just so much happening that it was like, I'm not gonna tackle that specific question in the depth that it needs right now.
Excellent. Thank you, Ben. Thank you, Ben. We have a question. Go ahead, Tracy.
So I think this might pertain a little bit to Ben was talking about. So we had a question. What are your thoughts about what seems to be a growing skepticism of science and uptick in the number of Google experts? Do you think there will be long-term impacts to public health moving forward due to that?
Good question.
You know, let me talk about a couple of things. So I want to come back and give my perspective on the question that Ben just answered. But you know, in a way, I feel a little bit of imposter syndrome myself, right? I'm a food microbiologist, who's studied bacteriophage for a little while. What possible right would I have to weigh in on any of these issues? And so so to a certain extent, I'm guilty of that, right? Like what do I know, right? I mean, now granted, I have spent 30 years thinking about risk, and I understand probabilities, and I think I understand a little bit about movement of microorganisms, and I understand, you know, how viruses are the same in some cases and different in some cases from bacteria. And so but I guess I'm optimistic. I mean, yeah, sure, there's people out there that are going to give misinformation, and certainly the internet makes it really easy to spread misinformation quickly. We've seen some some of the big social media platforms like Facebook be able to basically allow people to tag information as misinformation, and the same thing on Twitter. And so I think that that's helped. It's definitely a challenging time, and you know, the cries of fake news, you know, are interesting, and that's a whole different political discussion. But I think that, you know, I think overall, again, I have to say, at the end of it, I'm an optimist. And I think that we're going to get through this. And I don't think that there's going to be, I mean, there's going to be damage to science and to credibility. And this kind of segues into my answer to Ben's question. The whole time he was talking, I kept thinking, well, what regrets do I have? What would I have done differently? And I couldn't think of anything. And then right at the end, it occurred to me, you know, one of the things that I was very guilty of early on was underplaying the risk of the virus. You can go out and you can find some episodes of, not our podcast, but we did, our friend Max invited us on another podcast, and we talked about COVID-19 risk. And I really didn't think it was that serious a problem, and I have since, you know, come to change my mind about how serious I think it is. And I guess the only saving grace is I also listened to a podcast called This Week in Virology, which is done by a bunch of virologists, like basic science virologists and immunologists, and some of them also kind of underestimated the risk. And so I think that we're all learning. And I was pretty sure on that the risk of transfer from surfaces was low, but once I started cluing into that and looking for evidence that you could get the virus from a surface, I realized that no, my intuition was right, and I've become even more firm in my opinion. And I guess that's the nature of science, right? I mean, I've heard it described as keeping an open mind, but not so open that your brains fall out, right? And so I'm or strong opinions loosely held. Like if somebody comes to me with facts that will allow me to change my opinion, I'm ready to do that. And one thing that I keep meaning to dig into is one of the publications that I think a lot of people have been criticizing on the internet lately is the article about the Sturgis motorcycle rally. There was a paper published by a bunch of economists that said, oh, you know, this rally resulted in a huge uptick in the number of illnesses, and some friends on a private Slack you know, talked about it. And I said, well, I looked at it and it looks, you know, reasonable, and I can understand why they got their cost estimate if you believe the number of cases. But what I didn't understand is, like, what I didn't critique enough was, well, how could you actually get to that number of cases? And what I still, and I've read some of the, so I've read the article, or read some of the article, and I've read some of the takedowns of the article. But what I haven't done is I haven't taken the time myself to actually work through maybe some back of the envelope risk calculations to say, okay, let's make some assumptions about the number of people coming to that motorcycle rally. How many people were there? How long were they there? How many would have had to be infected at the beginning to lead to so many infections at the end, to lead to so many infections when they all went back home? And I haven't done those back of the envelope calculations. And so, I mean, I think we all need to be, maybe, and this is maybe advice for me as well as for others, we all need to be a little bit patient with ourselves, right? Like, I'm going to offer my opinion. I'm going to hopefully offer my opinion in a way that you understand where the caveats are and where the uncertainties are. You know, and I'll get stuff wrong. I mean, we're all going to get stuff wrong. But the thing is to say, okay, well, yes, and to admit it, say, hey, I did a thing and I got that wrong, and here's what I think now, and here's why I think that, and let's move forward from there. So yeah, that's my take.
Thank you very much. Ben, do you want to add something to that?
Yeah, I think, I mean, the mistrust or distrust, or you know, thinking about science and where its places in society it's not new. I mean, we're dealing with this today because this is a massive situation. But you know, there's been vaccine issues. If we go back, even in the food world, we look at GMOs. But I mean, for history, there's always been you know, I guess naysayers of a scientific process, and that doesn't dissuade me from being a scientist. I think one thing, and this is similar to what I've talked about in the past about what we do in the food world. I think it takes time for us to describe what a scientific process is and how we make decisions. And we don't do a lot of that in non-crisis time, right? I feel like it's just not important enough to put our time into this. And I think we collectively, and it's not any one individual on this, but then when it is a crisis like we're having right now, and we have to make decisions that are based on data, without doing the legwork to bring people into the fold of the uncertainties that exist all the time. Like there's no perfect paper that answers the types of questions that Don and I get all the time. Nothing was designed in a very specific way. So we're always balancing justification of what we know about pathogens, what the setting is, our informed best guesses, informed by science. That we don't tell that story enough. Because one of my very favorite examples of this, Don and I have talked about this in our podcast, is cooking temperatures and recommendations for poultry that differ between Canada and the US. I'll equate it to, it's 165 here in the US and it's 180 in Canada, and it's the same group of trained scientists essentially that are looking at the same set of data, but there's no one paper that answers that question. And you can arrive at slightly different answers. And sometimes there's more information that comes in that changes your mind. And that process is iterative and it takes time. And so I think part of our current situation is no one cares about that story. Right? Like a headline, and I'm as guilty of this as any, as I'm reading through things that are outside of my field. I'm like, oh, look, this is important. This isn't important. I don't go to the primary literature too much about it because I just don't have time or I don't care. And folks who are outside of our world, I think, also experience that. And we just haven't collectively concentrated enough on telling people how complicated our process is, other than saying it's super complicated, don't worry about it. And I think that social media changes that. I think when Don and I started Food Safety Talk in 2013, I had a vision of what people wanted to know about food safety, which was they wanted to read about something, first of all, in a short snippet that had some narrative, right? Like that's why I was part of Barf Blog. That's why I wrote op-ed articles. And then all of a sudden, Don was like, hey, we should do this podcast. I'm like, okay, I like to talk, so why don't we talk together? And then all of a sudden, there was this other group of people that wanted different information in a different way, that were just normal people that wanted to know about food safety, but they also wanted to know about the process of it. And so social media, it's not all good, it's not all bad. It gives us access. Podcasts are different from a meme that's posted on Facebook, and it all goes into this big pot. And I think the overwhelming part for the scientific world is, what should I do? And we have colleagues who are like, I'm not gonna do anything. I'm gonna go do the things that I know how to do in the laboratory, and you guys figure it out. And then others who are like, I want to join into this. And there's no right or wrong on that. But I think it's not, I guess it's not, this distrust isn't new, and it's not ever going to go away. Like there's no day 10 years from now where everyone's going to be like, science is perfect and everything's amazing. I think it's just a continuous battle that takes our time to deal with, and it's part of what we do.
Excellent.
Yeah, and I'll just add to that, like a lot of my colleagues, they don't want to talk to the news media. Oh, I was misquoted once. I don't want to do that. It's like, well, okay, then you're not part of the conversation, right? Like, I'm willing to get out there and talk to reporters, offer my 2 cents, explain what I know, what I don't know, where I'm comfortable commenting and where I'm not. And either you're part of the conversation or you're not. And if you're part of the conversation, one of the risks of being part of the conversation is you'll mess something up. You'll say something wrong. But I would much rather be part of the conversation and be wrong some of the time than not be part of the conversation.
Mm-hmm. Excellent point. Excellent point. Now, we know, obviously, this ever-changing global situation of COVID-19 has really increased food delivery. And we want to talk a little bit, I'm going to switch over into food delivery a little bit, and scientific research and the Conference for Food Protection And I just want to hear from your perspective, what insight could you provide all of us from a food delivery, from your vision of the world? Ben, would you like to go first?
So
Don
okay.
Don starts.
Oh, Don, go first? Okay.
So usually Ben goes first, but I think I've got something. Usually I let him go first because it takes me a while to think about what I want to say, but here I know what I want to say. So I had the privilege of chairing a CFP committee on food safety and delivery and mail order foods. Was very much looking forward to seeing that report presented in Denver at the Conference for Food Protection. That obviously didn't happen, but hopefully will happen at some point in the future. And so, and obviously, food delivery has been huge during the pandemic. Again, as I said, one of the comments, things that I was asked to comment on fairly early and did comment on Twitter is, do I need to sanitize the outside of my Amazon packages, or do I need to sanitize my Instacart or delivery or my Grubhub Uber Eats delivery? And the answer is no, I don't think you need to do any of that. The good news is that those industries, the people in those industries, at least the ones that were part of our committee and the ones that I know and I work with, are very conscious of, well, number one, they're conscious of the opportunity for them. I think they're also conscious that they need to, it's a business opportunity, but it's also an opportunity to lose trust. And so they need to maintain that trust. And again, I've talked with, and I know Ben has as well, talked with people who work for some of these companies. They've come to us for advice. And again, I've talked with news media about like what's the advice for both the delivery driver as well as the person receiving the delivery. And the good news is, again, it's sort of a simple message, right? The risk of the virus comes from other people. And so stay away from other people. Stay 6 feet away if you can. Wear a mask if you can. If you can use contactless payment within an app or with a credit card. I mean, we don't go in too much for delivery services, but we do have a Thai restaurant in my neighborhood that I patronize regularly. And one of the things that I do is I give them my credit card number over the phone. Now I still have to sign the credit card slip with the pen that they provide, unless I bring my own pen. But they do have a big bottle of hand sanitizer. So again, and we know from our discussions earlier that I think the risk of that is fairly low. But again, hey, if there's hand sanitizer there, why not sanitize your hands? And so I think that those companies are, at least the ones that I know, the big players. I dropped a few names. Apologies if I forgot to mention your name before. No endorsement intended and no slight intended. But they're paying attention to this, right? They're educating their employees. They know, or they're not always their employees, they're contractors, whatever they call them. This is an important opportunity for them, and they need to not drop the ball, and they need to do things that are right in terms of food safety and in terms of managing COVID-19 risk. And so, it's interesting times. And I think, and I've said this before, and it's sort of a more general comment. I think the pandemic is taking trends that we already saw happening and sort of accelerating those trends, right? I mean, I chair the webinar committee for the International Association for Food Protection, and boy, have I been doing a lot of webinars recently, way more than before, because guess what? That's the way that we're communicating now. And so I think that that's an example, right? Getting food or other things delivered is another example. And so we're only going to see that accelerate during the pandemic. And I think and working from home is another example, right? All of those things are being accelerated by the pandemic. I don't think we're going to go back. I don't think that we're going to go back to exactly the way things were. I think there's going to be definitely long-lasting changes that were probably happening anyway, but that have been catalyzed by the pandemic. So, yeah.
Thank you. Ben, do you want to add something to that?
No, just really supporting what Don said. I think that the thing with the changing landscape, and especially when it comes to food delivery, was I don't think there was for many consumers, many shoppers, there wasn't like a reason to try it, right? This thing was floating out here, and it's like, well, I'm pretty comfortable with how I get food now. And then all of a sudden something really changed. So now it's like, oh, well, there's all this infrastructure. Maybe I will try it. And I agree with Dawn that I don't think it will necessarily go back to the way it was. And I think that what was very heartening, I guess, about all of this, from a stepping back and seeing food delivery, curbside, takeout, was just how nimble the industry was to say, okay, we see that there's a problem here, that like a global problem, that we're going to be part of the solution on, and we're going to figure out how to make people be comfortable with this. And I think it was Domino's, you know, again, not to call out, they're not sponsoring the show, but I think Domino's Pizza was the first commercial that I actually remember seeing where someone said, because we have concern about food safety, we're doing these things, these practices, right? And those weren't really food safety practices, but it was like, I'm sitting watching some show and I'm like, I don't remember on like national TV anyone saying food safety before. Like, we're in our own little pod of things. And it's like, wait a second, obviously there's a reason why they're saying that. And they're talking about contactless delivery, food delivery, like how they're managing this situation, and you know, write notes in the app and tell us where you want us to drop it off, and all that kind of stuff, which was, I don't know, I guess it's very, that change happened much quicker than I would expect. And I think probably out of necessity, right? Like either you're in business and you change, or you're not in business anymore because there are concerns. But just that nimbleness of it. I did joke like early on quite a few times that there's no better time in history to have a pandemic that forced us to be at home, where I can get all the entertainment that I want via the internet, and I can get all the food that I want via my phone. I think having something like this happen to us 10 years ago would have been, and again, this is like in April, would have been drastically harder. And now, you know, I look back at that and I'm like, oh, you know, we've got almost 200,000 people dead and millions of illnesses. It's still not there's never really a good time for a pandemic. But the infrastructure that was built, as Don said, was catalyzed by this situation. The only other thing I'll add is I also had a bunch of questions early on from delivery, like from companies that had their own in-house delivery and delivery companies. And they were, and I think still are, concerned about like, what can we do to protect our staff, right? Like, yes, there's a forward-facing view of what we're doing is less risky to you as a consumer, but also we might be sending our shoppers into stores multiple times, or going back and forth to multiple houses, interacting with lots of people. How do we, like, we've never really had to think about this before. What we've been really concerned with is temperature of the food. Now, what do we do? Like, should they all have, like, you know, should they be changing their masks every time they get in their car? Like, and again, really early on, or what? And so that also, I think there was a very concerned portion of the sector that said, okay, if for this to continue on, we got to make sure that our folks don't get sick. So how do we best do that?
Very good, thank you. Tracy, do we have any questions from the audience?
Yeah, I have one that I think is fairly interesting here, and it kind of ties into the COVID-19 and the food delivery. So we have an attendee who says, I've had an issue with sanitizing everything, from things bought at the store like bags of chips to sanitizing my phone or workstation constantly. Do you have any suggestions on how to stop and what should be sanitized or disinfected?
Yeah, so I would say, at the risk of getting like too personal, like maybe you should talk to a therapist, right, or a psychiatrist. And this is something. No, I mean, this is a real issue. There are people that really do that have been you know, that really feel this on a you know, on a real mental true level. And so, you know, and again, it may be situational, right? Like, just like there's situational depression, I'm not a medical doctor, I'm not a psychiatrist, but there may be situational OCD or situational compulsive actions. And so don't be afraid to do that, to reach out. And I'm a big proponent in mental health and in taking care of your mental health, and that's something that we all really need to try to do during the pandemic. It's so important. But I don't have any magic solutions other than to say, the experts don't really think it's necessary. I do believe in hand washing and using hand sanitizers. I think it's a really good practice to do that after you've been out in the world. It's something that I do after I come back from taking my dog for a walk, mostly because I probably picked up his poop and I probably didn't get any of it on my hands. And even if I did, he probably doesn't have anything infectious in his poop. But you know what? It just makes me feel better to put that hand sanitizer on. Or to wash my hands after I come back. So so that's that. In terms of what you do need to sanitize, I would say my advice, and this works for restaurants, it works for homes, works for food processing plants. I think the CDC has some very good recommendations on their website, and so I would point people to the CDC website. But I would say the recommendations change depending upon whether you have someone who is showing symptoms or who has a diagnosis of COVID-19. If it's just everybody in your house and nobody is sick and nobody's been exposed, then you should just keep doing your normal cleaning routine, whatever that was before. Keep doing that. The situation changes if somebody is diagnosed with COVID-19, and at that point, I would point people to the CDC has some very comprehensive recommendations about exactly what to clean and how to clean, and how to disinfect. And so that's advice that I've given multiple times. So I'm curious to see what Ben's take is.
Yeah, I mean, same. Really, I think I really, as I've tried to communicate this issue over interviews and to family members, I'm like, I try to think of how the virus will move, and sanitizing or disinfecting is one way for me to stop the movement, but it's not going to move when it's on an item without hands or without some other facilitation of transfer. And so I'm much more concerned, and I shouldn't say concerned, I'm much more interested in controlling my hands and thinking about that. And maybe that's because I'm in a food safety world where I'm always kind of worried about that from a foodborne pathogen, and this is no change. But that's kind of how I've approached it. The thing that I've done to address this the most is that in my car, in both of our cars, my wife and I, we've got 2 big bottles of hand sanitizer that we just constantly use when we leave our house. And so it's like, and I'm like, when I leave the car, I put the hand sanitizer on. When I come back to the car, I put the hand sanitizer on. I think about all of the things that I have touched out in the world, and I don't know, like, I don't unmask myself before I do that. When I use the sanitizer, I make sure that I also put it on the steering wheel at the same time. And I'm like, okay, my hands are the root. So if I can just break it now, I don't really have to worry about the stuff that I just got from the grocery store, because I stopped it there. Then when I take that home and I put it in my fridge and my pantry, I do the same thing. And then when I'm preparing food and I'm taking stuff out of the fridge or pantry, I wash my hands. Or again, I don't use sanitizer in the house as much as I wash there, because I'm closer and I have an unlimited supply of soap. Well, I shouldn't say unlimited supply. That made me seem like I'm like all caught up in the pocket of big soap, but I have a lot of soap. Soap's not something that is limited. But I think more about my hands than anything else. And so and that habit has continued. Like, 8 months into this, I'm still using sanitizer every time I get back in my car.
I have one comment on the original question. We're working on a series with mental first aid, because a lot of people throughout the country are very much struggling with, how do you work at home? How do you become productive in society? How do you continue your career? How do you do the work-life balance? So we're really working on mental first aid. So that should be coming soon to support regulatory industry, because there's a lot of things happening out there. For example, from an industry perspective with COVID-19, where employees are getting abused by customers because they're trying to do social distancing, as a great example. And then regulatory folks are getting abused out there because they're trying to enforce, from a regulatory standpoint, what's happening. So again, we're all feeling the crunch, we're all feeling the pain. So when it comes to food defense, we're going to switch gears, if that's okay with everyone. And obviously, everyone on this call is about public health and protecting our communities. That's what we're all about. So what food defense best practices do you recommend in order to prevent food tampering? Ben?
Yeah, this is oh, go ahead. Yeah, I'll go first. If that's okay, Ben.
Yeah.
Yeah.
Yeah. So I guess what I would say is, well, it depends upon what we're talking about, right? If we're strictly talking about delivery services, I think tamper-proof packaging is the way to go. I'm sure we've probably all seen that video of the delivery driver taking a drink of the milkshake before he knocks on the door, right? But he was caught on the Ring doorbell or whatever it was. So I think that tamper-proof, we've seen, obviously there's been an interest in tamper-proof packaging, long before issues of food defense or COVID-19 issues. And so I think that the companies really need to innovate in terms of creating that tamper-proof packaging for delivery. In terms of other issues of food defense, I mean, obviously food defense was a huge thing after 9/11. We had a whole center at the University of Minnesota, the National Center for Food Protection and Defense, that I was privileged to be a part of, and did some good research on that, and good outreach on that. And so, but I think for the most part, the processed food industry, again, and the regulatory agencies have gotten pretty buttoned down on food defense, again, in issues arising after the anthrax mailings and after the attacks on 9/11. And so I think the processed food industry is in pretty good shape. And then again, I think that the leaders, the innovators in terms of delivery services, whether it's the in-house delivery from a restaurant employee or whether it's a third-party delivery service, I think that they know what they need to do, and it's just a matter of creating appropriate tamper-resistant or tamper-proof packaging.
Excellent.
Yeah. I mean, really nothing else to add. I think the tamper-proof stickers, I've just seen the rise of that. I guess I also, food defense is always one of these things where I think we don't know enough about often who and what causes people to tamper with food, and stickers, it might give us some assurance, but it's really not getting to the heart of food defense, which is, it's often a people issue. And so I actually work with someone here at NC State who does work with serial killers. This is where food and food defense gets to make a joke. Not the food, but actually the people that kill people. And there's not a whole lot of psychology on food defense issues. Like we know what gets tampered with, and we know that there are things, but I think, it's an area in general, regardless of delivery, that we need to think about how do we identify risks for food defense that are people-based, not packaging-based, I guess. If someone's really gonna tamper with food, a sticker is probably not gonna, it's gonna make me feel better as someone who receives the food. It's probably not gonna actually do much. Someone who wants to tamper with it is going to get to it before the sticker gets applied.
Excellent.
Not to put us down into the dumps on food defense, but.
Okay, perfect. Thank you. Tracy, do you have any questions out there?
Yes, let me just sit back. Okay, so won't the increased use of tamper-proof packaging increase the use of plastic at a time when we are trying to reduce it?
Yeah.
Yeah, I mean, this is, this is one of these issues where, which it's again, from my perspective as a risk assessor, it really gets interesting, right? Because this is what we call risk trade-offs, and so so it's easy to say, well, if I do X, I reduce the risk. That's great. But if I reduce the risk of one thing and I increase the risk of the other, now it becomes a lot more complicated. And we see the same thing with respect to food delivery and temperature control, right? Like we want to control the temperature because of food safety risks, but the way that we do that is maybe by adding more packaging. And if we are using styrofoam as a packaging material, well, that has ecological consequences. And so there are definitely risk trade-offs. And again, what we're looking for is maybe, okay, so what are some ways that we could still have good temperature control, but with less ecological consequences? Maybe not using styrofoam, maybe using some other packaging material, maybe going with the use of dry ice versus the use of those frozen refrigerator packs that I throw away on a regular basis, since keeping them in our home freezer is no longer allowed by my wife, who said, how many of these freaking things do we actually need, right? And so, but then there's trade-offs there as well, right? Because dry ice has its own risks, because if you touch it with your hands, it'll burn you. And so the short answer is there's no easy solution. And I guess maybe the more helpful answer is that's job security for smart people like us that are good at looking at the science and engaging multidisciplinary teams that understand ecological risks, that understand packaging and innovation and food safety, so that we can all work together to try to get better over time. But there's sometimes there's just not any easy answers.
Thank you. Ben, did you want to add anything?
No, it's all good.
Okay, perfect. So when we had talked prior to going in this program together, I had asked the question of what is industry and regulatory to do when it comes to people intentionally sneezing or coughing on food, for example, in a grocery store setting. So can we talk a little bit about that? Is there some best practices out there? Is there some continuous improvement that can be put into place? What can we do as a community in order to deal with individuals like this?
So let me tackle this one first, because Don got the last one. So I think we have to think about, well, what's the risk? What are we trying to prevent, right? So there's a gross aspect there, but what's our public health risk? And I don't want to minimize the gross aspect, because when I go to purchase food, I purchase food that's not moldy on purpose, right? Because it's gross, and I don't want to eat moldy food because it's not a good good experience. But I don't know what, if anything, that we can do other than have our industry folks who are out there in the food setting, just reinforcing with customers. Think about it in a retail setting, that we don't want people doing this. And then secondly, making sure that they're really heavily enforcing their own employee standards. I guess fortunately in this situation, I don't see a big public health risk, right? Like, it's not gonna, this enforcement of what, standards of keeping people from coughing and sneezing on food is not gonna reduce illnesses of any sort of kind for us. But it's part of this idea of, like, this is not acceptable here. We don't, and so like, I don't know if there's a regulatory role here. At my heart of looking at this issue, I think it really is, what are we doing within businesses and making sure that we're not having these terribly gross situations. But I don't know, Don, what are your thoughts?
Well, the one thing that came to my mind as you started talking, Ben, was all of these videos that we've seen on Twitter of people getting really aggressive in stores when they're confronted about not wearing a mask. And I don't know what the solution is. But it's, I guess, from a perspective of the store, you need to be really clear what your policy is, right? And if your policy is no masks, then if your policy is you have to wear a mask to be in the store, then you need to be prepared to confront people and ask them to leave the store if they're not wearing a mask. And if those people act like idiots and shout and scream and get posted on their faces posted on social media, well, that's just another thing, I guess, that we have to deal with. There's a thing called doom scrolling, where you just go on social media and you look at stuff and it just depresses you, but you can't stop. So I try not to do that. But boy, those people shouting about being confronted about wearing a mask, that just really kind of makes me sad. And unless it makes me angry, so I just try not to watch them. But yeah, but I mean, people should just stop being jerks.
Yeah.
Excellent.
I guess one little follow up to that is I did a webinar for agritourism businesses in North Carolina about a couple of weeks ago, and we had this Q&A session. We talked about, well, what do you do when a patron refuses to wear a mask? And one of the operators was like, that's a really awkward conversation, right? And it is, and this is what I think really differentiates the business owners and the operators that really get this from those that don't, which is training your employees to have those awkward confrontational conversations. And they shouldn't be put into this situation, but it is going to happen. It's only going to continue to happen. And just like knowing right up front, there's going to be a lot of awkwardness. Like this is, it is a difficult, even like what we do in food safety at a normal time, where you're like focusing on someone's hand washing practices, an employee or a manager, and you're like, you kind of probably need to go wash your hands. That's an awkward conversation. But so we have to continue to be ready for those, but also know that we've got to train people on how to have those awkward conversations.
Absolutely. Excellent. So far in today's interactive session, we've talked about COVID-19, personal, professional. We talked about food defense. We've talked about food safety. So to round it off, we want to talk a little bit more about implementing food delivery best practices and any type of a continuous improvement around food delivery. So who would like to go first?
I'll go first, and I'll say one thing that everybody should do is go and take a look at our CFP document that is posted on the Conference for Food Protection website. I think that would be a great start. It was written by a whole team of people. We had a lot of different opinions. We had public health people, we had lawyers, we had food safety experts, and that document, you could do a lot worse than to start with that document. And so, and if you should be able to find it relatively easily on the CFP website. I may even have it bookmarked, and I'll look for it. And when Ben starts talking, I'll look for it and then paste it into the chat if I can find it. So, but yeah, it took a year. I wouldn't say a year of my life. That makes it sound negative. I spent a year working very hard with a bunch of like-minded people to put that document together, and it would be a great place to start in terms of best practices. Start there, and if you implement all those things and you still have questions, then let me know.
Great, thank you.
Maybe you can serve on the next committee.
Okay.
And for me, and again, this will show where Don and I do kind of two different things. I really focus on how do we best communicate what we want our delivery infrastructure to do, right? What do we want consumers to be expecting? How do we want this delivery process to work? And I think that part of this is looking at whether it's like the gig economy of delivery or if it's in-house employees, being able to arm them with all the right information and education and training opportunities to make sure that they know how to best protect themselves firstly, but secondly the food that they're delivering from not just our like COVID-19 issues, but our food safety issues. And one I guess like aha moment for me if I look back at my career in what works in training and behavior change, was reading psychology, um, uh, the, from the psychology literature about what motivates people to do things and what motivates people to take risk reduction, and being able to communicate to them, the person we want to take that risk reduction, why. And not just because this is a series of things that our company expects you to do, but if you don't do these things, here's what it exposes our customers to. And you're building this world of connection to people. And so I think that for me, making sure that those practices in the CFP report, they get implemented in a way where it's really communicated to everyone in that chain of why this is important stuff to do and what are the consequences of not doing it. And it's not like busy work that we're just kind of making up for you to do, that we want to present something that's important, but it does have you as a delivery person have a role in public health. And I don't think we really do that very often. I don't think we talk about the public health role of a food employee or of a delivery person to them and make them part of that conversation.
Excellent, thank you. So
yeah, and so I did paste some links in the chat. Unfortunately, it looks like the chat only goes to the organizers and the panelists. I don't have a way to chat to the to all of the attendees, but certainly if you guys can point people toward that. It's basically Council 3, Issue 4 on the CFP website. So and then also I see it looks like we have a question in the question box from an undergrad. Can we answer her question?
yeah, Tracy.
Absolutely.
Okay, so I'll read the question.
Go ahead.
I'll read the question, and Ben, I'd like your take on this. As a current undergrad majoring in food science, what does the entry-level job market look like? Also, recent news links the president basically saying getting a bachelor's of science degree is a waste of time and money. Can you reassure me that he's wrong, although I know he is?
Okay. So I mean, Dawn and I both interact with students quite a bit. I have multiple students who I've either come to my program for graduate school or have introduced me through our food science club to undergrads in the food safety, food science world. And from my understanding of the job market, and again, my understanding of the job market goes back to March. So I don't know what it looks like today, but my understanding of these interactions is that things are good. We have really, really high placement rate within the food industry, within the regulatory realm, within academia for graduates, at least for those who go to NC State. But I'm sure it's the same at all food science departments. I think the caveat to that is the job market is good, the salary structure is reasonable, but the jobs might be not close by to where you live or at different times of the day. And so that's the trade-off. Don and I have a bunch of colleagues who have been in the food industry, that have worked on the third shift, that work in the microbiology lab at a major food processing plant, and those are high. What am I trying to say? They're high stress positions, and because putting that food out the door hinges on their ability to sign off on it, and the quality assurance and microbiology aspect. But I also think it's really, really rewarding from those who I've talked to in that area. So I don't know. My take is that there are jobs that will continue to be jobs, because food safety is certainly not going away. Yeah.
Yeah, and the only thing I will add to that is to say I went into food science in, however many years ago, 1979 that was the year that I graduated from high school. I went into food science because I had a conversation with a food science professor who said, look, you'll have job security no matter what, people have to eat. And so we'll always need food scientists. And that has so far proven to be true. It's certainly proven to be true during the pandemic. Food workers, whether they're working in meat plants or harvesting in fields or working in factories, you know, we've needed food scientists to help do all of that. And so the food industry, you know, continues to be an essential part of our economy. And so I think that the prognosis is good. It is a little bit challenging, but I have heard of people finding jobs and working those jobs remotely to start with. And so, so even again, I don't have any current information, but if you go, the Institute of Food Technologists publishes a salary survey, and we continue to have a high, you know, good, well-paying jobs. Even, I don't want to say even with a bachelor's degree, that sounds like I'm being a snob, but if you graduate with a bachelor's degree, you can find a job. If you go on to graduate school, you know, if that's your thing, then you'll also be able to find a job. I'm mostly familiar with our graduate students because I work as a graduate program director for our program, less so with the undergrads, but as far as I know, everybody who is looking for a job has found one, even in these challenging times. And so I would just encourage Olivia to stick with it and you know, just pay attention to smart people who know about the field. And not people who don't.
Excellent. Thank you. Yeah,
I'll put in another little plug. So there are many regional IAFP affiliates, IFT affiliates, APTO affiliates that are really good networking places for students as well, graduate and undergraduate. And so I'd encourage any students to look for those affiliates. And you know, as I've traveled around the US and spoken at many meetings, it's different. You know, in some states, one affiliate really drives all the food safety and food science, and in others it's multiple. So you kind of have to like figure that out in your specific location. But that is like to me the most fruitful way to enter into the job market.
Yeah, and I'll just tag onto that and say network, right? Meet people, talk to people. If you're an introvert, I'm not a huge introvert, but I'm more introverted than extroverted. I know as an undergrad, it was really hard to meet people and talk to people. But the more that you can network with people, you know, I hate to say it's not what you know, it's who you know, but it is what you know, but it's also who you know. And a lot of job opportunities do come from talking to people. And so don't be afraid to get out there and meet people. And talk to people. Olivia, talk to your professors, talk to your fellow students. Hey, talk to some graduate students in your department. Like get involved in your local student clubs. You know, find opportunities to talk to people. Get their business cards. You know, people. This may seem weird as to a young person, but people love to give you advice. And I remember asking people for advice throughout my career of older, you know, more senior people, and they were always happy to give me their opinion. And I might not have agreed with it, I might not have liked to have their opinion, but people will always give you their opinion. And just look at this. This is a whole show of people just giving their opinion over and over again. So people do love to give their opinion. So don't be afraid to reach out to people, Olivia, people that you trust and respect, and ask their opinion, and ask multiple people. And what you'll find sometimes is that you hear the same thing over and over again, or maybe you'll hear different opinions, but that'll help inform you. So don't be afraid to reach out and ask people what they think, just like you did here asking a question today. Thanks.
Excellent advice. So Tracy, do we have any more questions?
Yeah, I've got maybe two more that I'd like to throw out there. This one I think is kind of a up and coming topic that everybody's thinking about now, and it's about when a vaccine becomes available, should food workers be required to get it? At this time, only 50% of the U.S. population states they would be vaccinated or would be willing to get vaccinated. What's you guys' thoughts on that?
Ooh, so I think there's a lot of like complication wrapped up in a vaccine situation, right? So once we get into requiring things, we have to think about access to it, we have to think about the cost, and we have to think about the timing for coverage. And if we look at hepatitis A as an example that we've talked about tons in the food industry, we have difficulty with both coverage and cost. It's an expensive vaccine, and it requires, by coverage, I mean it requires 2 separate shots to get that coverage. And so Don and I have talked about this quite a bit. I've wavered over time. I think there's a lot of benefit to requiring, from a business standpoint, all of your employees to get a hepatitis A vaccine. I do think that it's very problematic and difficult in a to do so across all food handlers, because I don't think there's, first of all, enough vaccine, and I think that it is a very expensive approach. There's a lot of disparity issues. I mean, that's something else that we haven't talked about on this podcast, but we certainly know with our current situation and climate in the U.S. that we have disparity problems, and now all of a sudden to add on, if you're going to be a food handler and make the very least amount of money in our system, and you've got to go get a $200 vaccine just to get that job, I find that very philosophically difficult. So I think it's totally legitimate and fine if I'm a business, pick a business name that says, for you to work here, you're going to have this vaccine, and I'm going to pay for it because it's part of the tool that I need you to have. That I'm okay with. Widespread mandatory vaccinations of any side, I think, comes with challenges. And I'll be real clear, it's not a vaccine challenge. I don't have any problem saying you must have a vaccine to, like, not from an anti-vaxxer standpoint. That's not my issue. It's tell me about the logistics of how we're actually going to do this, because I think that's something that we have to think through.
Great.
Yeah, I think Ben nailed it. And if we had more time, we could go on about social justice issues and how I've become a radical democratic socialist in the last couple of years, but we probably don't have time for that. But yeah, I mean, I think Ben has absolutely nailed it. I think it's a good idea to require food workers to get the vaccine, but to not pay for it, that's just not right. And so yeah, people need to do what's right for their workers, because I mean, we've discovered through this whole pandemic, we've discovered that food workers, from throughout the industry, have an incredibly important job. For many, it's a very hard, physically demanding job. For many I'm thinking specifically here about meat and poultry workers who've been sick with COVID. It's been devastating for them. And we need to come back to my earlier comment. We need to eat. We have to take care of these food workers because they're the ones who kept us fed throughout this whole pandemic. And it's just really important that they get treated with respect and be paid a living wage. And yeah, we just have to take care of them.
Okay.
Fantastic.
Tracy, you said you had one more question before we go today?
Yeah, if we can real quick just talk about, do you envision any COVID-19 related late breaking issues being submitted for the upcoming CFP biennial meeting in the spring? Or maybe that isn't a short answer question.
Tracy, if I could predict the future, I would have bought Apple stock 30 years ago. So I am clearly not good at predicting the future. But it wouldn't surprise me to see some late breaking issues. I'm not sure what they would be, but I mean, I just have to say, let me just vamp for a little bit and say, I love CFP. I love the Conference for Food Protection. I love what it's trying to do. It drives me up the wall when the issues that I support don't get passed, but I keep coming back. So they've hooked me. I'm in. Yeah. So hopefully, maybe there'll be some late breaking issues. That would be fun.
Yeah, and I'll answer this super quick. A lot of the interviews that I've done recently about restaurant restrictions being relaxed and capacity, restaurants opening up and dining rooms have revolved around what do we do about compliance and where is teeth related to executive orders. And I don't think that that's going to go away. And in one sense, there's a natural spot within the food code. In another sense, it's not a foodborne illness, and we don't manage other employee health or employees to customer health issues there. So it wouldn't surprise me if it's there, but I bet it's going to be a very contentious set of issues. And I don't know what the right spot is. I do think that asking people to call the sheriff's office to like say, someone doesn't have a mask in my restaurant is probably not sustainable or the right thing, but I don't know if the food code's the right place either.
Excellent.
Yeah, and,
Go ahead, Don.
just quickly to that point, Ben, like we don't have provisions about flu in the food code, right? And so, yeah, I think that's a really good point you made.
Yep.
Sorry, I'll shut up.
Wow. Thank you, Dr. Ben. Thank you, Dr. Don, very much for 90 minutes of action-packed scientific collaboration that has been fantastic. Thank you. Be safe and be
Ben,
well.
our pleasure.
Thank you.
Be well.
All right. Thanks, everybody. Stop back in September for our next one.
Yes. October. Yeah. Bye.
Oh, I'm sorry, October.
Bye, guys.
Bye.
Bye.